Good evening and welcome to the case study discussion regarding the ethical issues in medical field as requested by both of you. So in every healthcare profession, we should apply the principles of values and ethics, which is respective of the profession when we dealing with the patients and also their families and also providing care. With utmost consideration to the right and autonomy of the patient, it's important to understand and respect the obligation and the fairness for the benefit of the patient. So basically, ethics in the medical terms, we will explain regarding what is the right of the patient, what is the right of the family of the patient, what is the ethical of the doctor, and all the one in a medical setting. So in front of you, I already have a case study as an example to both of you to know in detail regarding what is the ethical and values in a medical setting. So the examples: Anna, 28 years old, has been diagnosed with a clinical depression with a family financial and has been suddenly have a stroke leading to the vehicular accident. And also the doctor decided to treat her regardless of the demand. After a week, she have referred to affiliated facilities and designated healthcare service. So Amir, you have any question regarding the case studies?
Yes. What type of unethical behavior is present in Anna case?
Okay, so when we see in this case, the Anna doctor is practicing healthcare fraud. Okay, in healthcare, the fraud is really prohibited because it will damage the reputation of the patient, the healthcare of the patient, and the healthcare of the society itself. And we can see the fraud that been done by this doctor here is the addition of the compensation, where he tend to add any values to amount to get back to the Anna as a referral. Okay, Amir, clear about that? Okay, Arif, you have anything?
So I have a question. So what could be the effect of this unethical behavior towards Anna?
So when we see in this case, the type of unethical behavior will impact the healthcare provider itself because the doctors represent the hospital, the name, the branding of the hospital, and also the healthcare individual itself, the professions itself. So it can lead to doubt and hesitation to accepting any medical advice and intervention. So after any of the patients coming to the hospital and already know the doctor is doing fraud, so they will scared. Is that we can rely on this doctor? Okay, Arif?
Okay, I think finally from me, can you explain the key values for deciding the ethical issue?
Okay, key value on deciding the ethical issue, basically we have 4 basic values. Okay, so the first is the principles on the deciding on the ethical values is the autonomy, where the patient basically have the right to determine their own healthcare. Second is the justice, distributing the benefit and the burden of across society. The third one is the beneficence, which is doing good for the patient. We have to do good to our patient, and non-malice is to making sure we are not harming the patient. So finally, about to question with us, I hope both of you clear regarding all the ethical values in the medical profession, where after we done all of this, we can really embrace the culture of diversity in individual difference that characterize patients, population, and health team. We also can create a unique pattern of structures, of values, of the responsibilities. We also can develop trusting relationship between the family members of the patient with other members. And also we can demonstrate high demand of the ethical conduct and the quality attribution to the team-based care. Thank you for your time. That's all.